Demonized and suppressed by the war on drugs, psychedelic medicines are making their return, and we're here to bring you the latest in scientific research and therapeutic practices involving psychedelic medicines from psilocybin to ayahuasca to DMT and beyond. This is the Psychedelic Medicine Podcast.
Hello and welcome to the next episode of the Psychedelic Medicine Podcast. I'm Dr. Lynn Marie Morsky, your guide in this journey, and today we are talking psychedelics and sexual trauma with Laura May Northrup. Laura May Northrup is an author, educator, somatic psychotherapist, and podcaster. She's the host and creator of the podcast Inside Eyes, an audio series about people using entheogens and psychedelics to heal from sexual trauma. Her work focuses on defining sexual violence through a spiritual and politicized lens, mentoring healing practitioners in creating a meaningful path, and supporting the spiritual integrity of our collective humanity. Dear listeners, I have to say this is one of the most important episodes that I believe we've recorded. What Laura talks about is not only how psychedelics can help heal sexual trauma, which affects so many of us, but also we touch on the fact that psychedelic trauma is happening within our psychedelic healing settings. And that's a big problem, and it needs to be more acknowledged. And we discuss ways that those who've experienced that can try to identify when they no longer feel that they are safe in a situation and how to move forward from there, and some of the things that the community as a whole is doing to try to make this less of an issue, to heal the practitioners who are doing this kind of disservice to their patients and their clients. And so this is really important from a lot of aspects. So I don't think I ever asked this, but if you would share this one widely, because not everybody may tell you that they have been subjected to sexual trauma. A lot of people suffer in silence. And so sharing this may give somebody the tools to listen and say, oh, maybe psychedelics can help me in this setting or that setting. Or if they have suffered sexual violence at the hands of a psychedelic practitioner and didn't feel they had anywhere to turn, this is something else that will hopefully give them some resources. Now, before we get to Laura May Northrup, just wanted to remind you that the Psychedelic Medicine Podcast is for educational and informational purposes only. Nothing here is to be construed as medical or legal advice. And this episode is special because Laura gives a lot of advice directly to practitioners. And that is something that the Psychedelic Medicine Association would love to have all of you psychedelic practitioners join us. We are an association of people teaching mainly like primary care physicians and other healthcare providers that may be outside of the psychedelic realm about psychedelics. However, having psychedelic therapists with us helps us with that education because clinicians have a lot of questions about what it looks like in that psychedelic therapy session. So if you are a clinician in or outside of psychedelic therapy and you would like to be part of moving this field forward, please join us over at the Psychedelic Medicine Association, which you can find at psychedelicmedicineassociation.org. Now, without further ado, thanks so much for joining us today, Laura.
Hi, thank you for having me here, Lynn Marie.
I'm really honored that you've come to share with us because I saw you speak at Horizons, and I think you could have heard a pin drop before all the applause because, I mean, you were addressing something that it's so present right now in our industry with some violations of sexual boundaries in psychedelic therapy, and the way you spoke was so powerful, and there was a lot of personal experience in there. And then I found out later that you have a podcast that discusses psychedelic healing of sexual trauma. And so I'm very honored that you've come on to discuss both of those topics with us. If you could just give just a short background about what led you into the work you're currently doing.
Yeah, so I'm a psychotherapist and I'm somatically trained and practicing and relationally trained and practicing. And I've had a long time, I guess I would say, interest or relationship to psychedelics. And then in the last several years, got more interested in very specifically psychedelics in relationship to healing, um, PTSD, trauma. And then very specifically because I work with a lot of people with sexual trauma, I just saw that there was a way that a lot of the modalities that we use that are really respected modalities to heal sexual trauma, people oftentimes can really get a lot of healing, but there's sort of this threshold where people really struggle to make it past that point. And I knew people were doing that with psychedelic medicine. And so I felt really passionate about sort of exploring it and showing that option to people. And I will say, in showing that option to people, so I have this podcast, Inside Eyes, where there's several really in-depth interviews with survivors of sexual trauma about their experiences, what kinds of psychedelics they've used to heal, what other types of modalities they've used, what their symptoms are. Um, and while I was making this podcast that's like, really singing the praises of psychedelics, I also felt a lot of responsibility to put some episodes in there where I talk about that it is the case that some people go to psychedelic medicine spaces and actually experience sexual trauma, as well as there are several other things that can happen around psychedelic medicine that we need to be privy to, and not sort of just like idealize it, but really see it in its complexity. So that is a piece about kind of how these two worlds intersect for me. The fact that I really enjoy supporting survivors to heal, but also that we need to be talking about this very, very concerning issue of people sexually abusing their clients.
Yeah, I think that's so useful that you come at it from both angles because they're with so many things, it's how well are we using these tools? They can be incredibly powerful tools and incredibly powerfully misused. And so I appreciate that you bring both of those to the conversation. I'd like to start with you talking a little bit about I don't think in the research that I've done, and please correct me if I'm wrong, if there's been specific research done with victims of sexual trauma, or has most of that research been kind of like lumped in with PTSD overall
Uh, do you mean specific
with
research
psychedelics?
with psychedelics? I do not think that there is research that is specific to survivors of sexual trauma using psychedelics. I think in the cases that, like for example, with a MAPS trial where they're talking about PTSD, there may be people who are in that trial that have sexual trauma, but they're in there along with people who have all kinds of traumas.
Yeah, that's what I had seen so far. So mostly what we have, and that's why your podcast and your experience is so important, are anecdotes of people's individual healing. So if you wouldn't mind sharing some of the trends that you've seen with maybe perhaps different psychedelics and therapeutic modalities that put together have shown some efficacy in healing sexual trauma.
Yeah, so whew, I'm like, the trends. I mean, one of the biggest things that I noticed that I think is important for people to know is that uh, people who get really a lot out of their psychedelic experience and actually do a very substantial level of healing, which then transforms their life so that they can actually live life in a way that they are living with much less PTSD. This is not based on any research studies, but in my personal observation, those are people who have done a lot of prep work. So in the field, we talk a lot about integration, where we're constantly talking about integration. And in a lot of ways, that term sort of implies that there's something happening after, or people talk a lot about what you're doing after the journey. And I'm really big on preparation, like what you do before the journey. And I'm a big fan, obviously, as a psychotherapist, I'm a fan of therapy. I'm also a big fan of meditation. And so for me, I try to really emphasize that um, doing a lot of like even more prep work than you think you need is actually a really good idea to get the best result. And also, I think that's important because in terms of mitigating risk, uh, doing a lot of healing before you go in is also a really good idea. And I think that's partly, once you're actually in the psychedelic journey, you need a lot of personal skill and strength to actually do the work. I mean, when people talk about this stuff, like it's so cool, it's so amazing. I'm like, when you go in to heal trauma, that is hard. Like you are doing very, very hard work. You're not in there being like seeing like rainbows and sparkles. You're in there like crying, sobbing, shaking, going into like the most painful stuff. So for that reason, I think doing a lot of prep work is good. But I also think doing a lot of your own healing prep work is good because I think it helps you to choose a better guide. So sometimes when people come to the medicine work and they're desperate and they're coming from a really traumatized place, they may not have as many skills to actually assess, like, oh, I am scared of this person I'm talking to. I don't think this person isn't really that safe. And maybe if you had a little bit more therapy under your belt, you might be like, yeah, and something I've talked about with my therapist? listening to my instinct that somebody's not safe. But when you don't have as much healing, and you're feeling really desperate, and this is one of the reasons that there can be so much abuse in this arena, you're vulnerable and you may choose to work with somebody because they're the only guide you've been referred to. It's illegal and underground. You're afraid you're not going to find anyone else, whatever the thing is. And then you may end up working with somebody that is either not skilled, like, so just, kind of bare minimum harm is like, okay, this person just maybe isn't really helping you that much, all the way to like this person could be abusive. And I mean, it's really sad that we have to even talk about this when someone's looking for healing. But so those are some of the pieces I see, is that doing a lot of prep work, doing a lot of therapy work, or whatever type of healing work before you go into the journey is really, really helpful to people. And then the other thing, oh, go ahead.
Oh, no. I continue.
So the other thing that I would say is a big theme I see is that when we're talking about healing from trauma, a lot of times what we're talking about is growing the capacity to experience and endure very big feelings. Um, and the other thing I'll say that I think we do a lot of, and I mean, I think in a lot of ways it's related and maybe same language or different language to talk about the same thing. But another thing that we do in addition to sort of being able to tolerate big feelings is regulating our nervous systems. And so these are two things where I think a lot of people go into this work and they may not be articulating it quite like that. But what they're either coming in with, so with a dysregulated nervous system, they're either coming in with being highly dissociated. So that's like downregulated, like overly downregulated, or very upregulated, so extremely anxious, or they live in those two extremes. And that's really common when you have severe trauma. And then with feelings, people who are sexually harmed usually have experiences where they've had to feel immense terror. They've had to feel a lot of rage, there's a lot of shame, and there's a ton of grief. And those are all really hard feelings to feel, and sometimes people are living in a space where the feeling is so overwhelming that they're soothing it with like a substance or some kind of process or something to just, to basically deal with it every day. So when people go into these psychedelic spaces, I think a lot of the work that happens is in the feeling realm and the nervous system realm. Of course, when we go into a psychedelic space, and I really also, I just want to add, I think about this all in a very spiritual way. A big part of my podcast is about thinking about sexual violence through a spiritual lens. But so when you go into a psychedelic space, even though the way that the person who goes in might be describing it, where maybe they're mostly talking about the visuals that they saw, if you really tune into what they're saying, and you can hear this in episodes in my podcast, where if you really listen to someone describing their medicine journey, they're actually talking about a very somatic experience. There's a lot of ways they end up talking about their nervous system without specifically naming that. And then there's a lot of ways they're talking about feelings happening that are now able to be kind of met and experienced without either totally shutting down or going into an extreme anxiety state. So those are the themes I see happening in that world. And people often ask me, well, what do you think about different medicines compared to each other? So like, what's the best medicine? And what I say to that is, I definitely don't think I can say what the best medicine is for anybody. I think it also really depends on what you're doing. Like if you're suicidally depressed, maybe you're going to be going and doing a round of ketamine therapy. If you're in a place where you feel pretty strong and you feel like you can do really, really hard journey and you're really ready for it, you might be doing like high dose mushroom work or work with ayahuasca or something like that. If you're in a place where you have sexual trauma, but you're trying to um, get out of an opiate addiction, like you might be going towards iboga. So I don't think that sort of question of like, but what's the best one to heal sexual trauma can really be answered. I think it's very case specific.
I'm very glad you brought that up. And yes, I was going to be that person who asked that question. And so I'm glad you already and I think the answer you gave is exactly like the answer I would expect, is like it's not a one size fits all. But you brought up something right before that leads me to think that perhaps checking in with your own nervous system, because certain psychedelics definitely affect the nervous system. Like you said, are you ready for a high dose journey? That's going to have an effect on the nervous system. It can, right? At some points it can get very intense. If your nervous system is already in fight or flight all the time, maybe it's not your nervous system isn't ready for that choice. Is that another thing that weighs into the decisions?
Yeah, I think that's another thing that weighs in, and I think that, with that, people get so into just kinda going and throwing themselves into a really extreme experience, and what I like to point out about, anytime you've had a severe experience of trauma or, specifically sexual trauma, um, you have already had an experience where you went in, experienced something way too overwhelming, and then had to come out of it and put yourself back together. And obviously with sexual trauma, you didn't do that to yourself. That's not sort of a consensual choice that you're making. But there's a way that people with trauma can actually recreate their trauma in their medicine work. And if you're going in unprepared and you're doing something really intense, you do run the risk of that. And I just like to point out to people, like you can do a low dose just to kind of get like started. Um, I'm a ketamine therapist. We always start with a low dose, and ketamine therapy, obviously is very very different than say like going and doing iboga or ayahuasca or something. Um, but I just really like to emphasize for people like you don't have to go the biggest and the hardest the first time. um, a lot of these stories that are out there about somebody, like, I don't know, just like, oh, I went and, took like whatever, a high dose and I healed everything and I'm okay. Like, you don't know what that person's life was like beforehand. You don't know what their life actually ended up being like before, like afterwards. A lot of times these are like YouTube videos where the person is frankly still high, like, or, it's like hours after their journey where they're kind of like, no, everyone should do this. So I just like to say, like, start out slower, go easy. For a lot of trauma survivors, that's actually novel to like give themselves a lot of care and go really slow. And I just think that there's nothing lost in that process.
I think that's a really important point that has only been brought up maybe once or twice other in our 100+ episodes. So thank you for re-bringing that up, which is, we have this no pain, no gain. Well, I'm going to go for the 4 days of ayahuasca in a row. Is your nervous system, are your adrenals ready for 4 days of ayahuasca in a row? Like, I appreciate that you've put a point on the fact that there's the room for low dose. There's room for stepping up doses. You don't have to go, it's not go big or go home. And that can actually have some negative consequences. I had a question because you had brought up how some people are dissociated. Uh, is there any harm in somebody whose kind of default is to dissociate to do a dissociative like ketamine?
Okay, I have a lot to say about that, but also I just wanted to say I saw this bumper sticker once that said, how that saying, "What doesn't kill you only makes you stronger." It said, "What doesn't kill you only gives you trauma." Like, hello, it's just like
Yes,
it's so much.
that's
I was
so
like, yeah,
true.
people, it's so true. Okay, so I'm actually really fascinated by this question you just asked about dissociation and ketamine because yeah, you would think, all right, somebody is highly dissociated, maybe doing a dissociative like ketamine might not actually be that healing because they're going to just be like dissociated. Um but I actually have this strong sense that's not based in any research, so I'll just name that ketamine is really useful for people who are highly dissociated. And the reason why I think that is, I'm going to try and explain this without using my hands so that listeners can really understand, is that when we're highly dissociated, uh, what's going on psychically is that there are large blocks between different parts of your experience. So maybe one part of you is able to, for example, know that you're angry at someone in your life who didn't protect you from abuse. And then another part of you loves that person because that person is actually a family member who cares for you. And the highly dissociated part is that you get around that person and you actually can't really be in contact with your anger. And maybe you also can't be that in contact with your love. Like you're just kind of there, not feeling a ton. And this sort of block, I like think about it literally like some kind of divider between parts of you. What I think happens in ketamine work is that those big blocks that divide up parts of ourselves, those soften. So ketamine is a dissociative, but with it defenses really soften. And so for somebody who has a really hard time, like, allowing different, for lack of a better word, parts of themselves be in contact and in conversation. I think ketamine actually really helps that, and what I've seen in ketamine sessions is that for people who struggle with that, um, there can be a way it's this is sort of complicated, I don't wanna get too technical, but basically, like, where somebody stops fragmenting, so instead of being having all these separate fragmented parts, um, and fragmentation, is the opposite of like, what we're trying to do with that is integrate, this concept of integration. So what I see end up happening and what I hear anecdotally about people is that they're actually able to have a little bit more of an integrated experience of themselves, even though they're high on a dissociative. And then, of course, the hope is that someone can take that experience where they name, oh, I'm mad at the person who didn't protect me, and I love the person who didn't protect me. And now that I've actually named this, and I can bring it into my non altered state realm and start working with it.
Okay, that makes a lot of sense. Thank you for sharing that. And I'm glad, because if there are people out there who dissociate now, they may not be quite as afraid of a dissociative, because that might have sounded a little foreboding beforehand. You brought up something. There were so many good points when you're talking about preparation. And I totally agree that so much is made on integration. But even in my own personal journeys, what comes up on the medicine are things that I've thought about beforehand, or things that a therapist or a self help book or whatever has said beforehand. It's like the raw material is at least there for the medicine to start making connections between those concepts. So I think that made a lot of sense. But also, I love the point that you put on people may not be in the place to choose a guide as effectively without that therapy. And so, can you talk a little bit about if we have survivors of sexual trauma who are looking at searching for a guide, what kinds of things they should be seeking out?
Yeah, so I'm happy to answer that question. And I also just want to throw out there that there's this sort of complicated thing where um, I'm always wary of giving advice where it's on the person who could be the target to solve the problem. Like, hey, here's what you do to not be sexually abused. And the reason I'm wary of that is because it's almost like, hey, if it does happen, it's your fault. So I just want to name that
Oh, can
I'm
I
happy to answer this question. Oh, go ahead.
Yeah, let me rephrase. What I meant is not so that they don't get sexually abused again, but so that, for example,
Oh,
if I am, talking with somebody who's a survivor of sexual trauma, I would advise they go to a trauma informed therapist so that they can best work with their trauma. And so my kind of like underlying question is, is it perhaps they should look for somebody who's got some experience with somatic therapy, or what kinds of skills in a therapist toolbox may they be looking for that might best help them, in
yeah,
addition to the
great
fact that,
question.
listening to their gut and making sure the person is not giving off bad vibes and all of that kind of thing. But like, what tools are probably most useful for healing that trauma?
Yes, sounds great question. Yeah, and I'm pro the other question that I thought you were asking too. I just like to name that because I really, really want to emphasize like that, we need to do that the people who are causing the harm need to stop causing the harm.
Right,
Um,
right. You can answer
yeah.
both questions.
Yeah. Well, so yeah, so to start with the question that you were actually asking, I agree. I mean, I think a really big part is that people it's really good to go to somebody who understands trauma. And that could be because they have an extensive trauma training under their belt. That could be because they have been in practice for a very long time, um, and have worked with lots of people who have trauma. It could be that you got referred to them by somebody who you've seen actually do a lot of healing work with that person, and you have a strong sense that they can do it. Um, I will say, I mean, this is, I feel like, sad, scary thing to acknowledge, but I think there's a lot of people who work in this field that don't have trauma training. And there's a lot of people who use this term trauma informed now. And, like, a lot of people use that term. And I think what it means is like they know what trauma is. But, as somebody who has been like highly trained in the treatment of trauma and I work with trauma survivors, I have to say, being able to work with trauma is like way more than just like a little tiny workshop. I mean, it's truly something you're learning how to do throughout your career. It involves a lot of extensive training and consultation and guidance from more seasoned practitioners. So for people who are listening who are maybe practicing this work, I'm like, definitely get a trauma training. I said this on another podcast. Somebody asked me, about what people need to get for training for psychedelic therapy, and I'm like, I don't even care if it's not a psychedelic training, get a trauma training, like 100%. So, as the person who's seeking out the medicine work, making sure that somebody has this stuff under their belt is great. And of course, you know, trauma training is a very kind of like Western uh, idea and like way of kind of getting trained. So, if you're working with people who are not practicing in that context, they can still be in their form of medicine work, trauma knowledgeable and informed and capable, but you'd want to be assessing that. Um, I definitely think somatic work is really, really helpful to have an understanding of. And I mentioned this in my Horizons talk, that I really think psychedelic work is spiritual work, it's somatic work, and it's psychological work, and correspondingly like mind, body, spirit. But most of the time, practitioners aren't trained in all three of these. So, for example, they're trained in psychological work, and then they're touching their clients during, medicine sessions, but they're not really trained in touch. Or somebody is trained to administer medicine in a spiritual manner, and then they're giving psychological advice to the people they work with, and they're not actually trained to do psychological work. So, I really think if you wanna see somebody really solid, and also if you're becoming a practitioner in this or you already work in it, that I cannot emphasize enough getting the skills to work spiritually, somatically, and psychologically, or understanding, like, gaining the skills to know where your limit is. So, you're working with someone spiritually, they have a psychological issue, that you stop at the point where you don't give them pop psychology advice. Like, you say, "Hey, this is out of my scope of competence, and I'd like to refer you to someone else." Um, and of course, as the person seeking the medicine, this is hard to assess. But one thing I will say is that anybody you work with, if you are a trauma survivor, you should be able to ask them questions. And if you're going to see somebody who's so well known and such a guru that you can't even ask them a question, they could be amazing, but just for you, like, you might want to wait to work with that person. You might want to work with somebody who's a lot more available to talk about what their training is, to answer your questions, um, and to give you some sense of what they do. So that's another piece, is I think just like how available is this person to talk. I think it's really important to consider whether or not it makes sense for you to do one-on-one work or group work. So group work is more affordable. Um, a lot of times it's very accessible. There doesn't tend to be like a huge wait list to work with somebody because they can see a lot of people at once. Um, but group work also means that you're in an environment where you don't even know what everyone else there is going to be experiencing. Like, they might be coming in with trauma that's actually really not good for you and your trauma to be around. However, group work also means that, you're building community. You maybe have other people to talk about your experience with after it happens. I think there can also be a lot of relieving of shame to be working in a group and really having other people witnessing you and seeing you. So group work is like immensely helpful, and there's so much community around it, and so much of what we are suffering with, and especially sexual trauma survivors suffer around, is isolation. So I definitely think that group work can be amazing. And if you are not ready to be around other people who are just like all over the place in their trauma, and you need a really tight container where you can do your work, and you really just need to be able to learn to trust like one person to get into this space, one-on-one work is also incredible, uh and it can be also shame relieving and beautiful and witnessing and go really, really deep. It also tends to be a lot more expensive. It also tends to be something that yeah, I think just like you might be reaching out and kind of talking to a lot of practitioners, and trying to find somebody who has space. So that's those are some of the things I would say are things that people can definitely be thinking about to maximize their healing, and then also to hopefully not be harmed.
Yeah, thank you for that. And we'll just acknowledge to everybody out there, this process is not easy. It's not easy to find a non-psychedelic therapist. I mean, many of us just trying to find a regular therapist from day to day have a hard enough time. It's like worse than dating. There needs to be like a very upgraded Bumble for therapists where you can, like try so many out, because it's just a really arduous process. Add insurance on top of that, even worse. Now you've got psychedelics. They're not even covering it generally. So, and half of it's underground. So we're, for everybody out there looking for a therapist, our hearts go out to you. I'm very often in that same boat with you. Like, it's just a difficult process. So thank you for giving some tips that people can use when they're evaluating. And then I think this is a good segue into, you alluded to the fact that in addition to them being a helpful therapist, we would like them to not be a harmful therapist. Is there anything besides like a gut feeling? And this, I think, we have to mention this. Google, because yes, there's two sides of every coin, but if you see 4 or 5 stories that mention the same person in an abusive situation, maybe, and you're coming with sexual trauma already, maybe you don't take the gamble on that one. Am I right in that in that
I
assessment?
would agree. Yeah. I mean, I think this is just like, and I think a lot of people with trauma, I don't know what the word would be, but like cut corners on their healing. Like, there's a way that when you've endured a lot, you are very resilient. And oftentimes you can kind of go through life and be like, you know what, I can handle that. Or you know what, I'm a strong person. And I believe you. Like, I believe that when you are a trauma survivor, you are a badass. Like, you are you are making it through life, and it's amazing. And like, again, I go back to that thing about like trying out a low dose at first. It's like there's no harm in choosing somebody where the risk level is very low. And so in that situation, like choosing somebody who is very, very skilled, and if they're more expensive, saving up to see them. If you are potentially going to work with somebody where you've heard some people have some critiques, actually just kind of following up. What's that critique? Like, is that critique that they started the session 15 minutes late? Is that critique that they did weird stuff while someone was high? Like, and just to really like uh sort of I don't know how to say this, but basically like no room for error. Like, if you're researching a guide and there's anything about them that's questionable, just see if you can find another guide before you go with that person. And obviously not everybody is like, nobody's perfect. I want to emphasize that, but there is such an incredible risk and the power difference when you are inebriated and someone else is not, or in the case with people who take the medicine with you, because I should say, for people who are really not very familiar with this, sometimes the guide takes medicine as well, but they usually take a lot less. Um, uh, yeah, just like there's such an intense power difference. You just want to be so, so careful. This is especially also, I think about sometimes the way people talk about this. They're like talking about it like this one journey is going to heal it all. This is like this huge moment, which I don't agree with that. You're going to do a bunch of journeys. Let me just like set this up for you. If you're a sexual trauma survivor, like it's a long game. However, if something is so powerful that it could do that much profound healing for you, like, man, just make it the best it can be. Go with somebody you don't have any reservations about.
Yes, yes, amen. So that's a perfect segue into, because you just mentioned like when you're inebriated and then there's this power differential, this is not the time to cut corners. Let's get into the difficult conversation that comes up when things do go awry in that scenario. So if you could talk a little bit about some of the potential dangers that arise from that differential.
Yeah. Well, so, there's such a wide range of what someone can do that's not ethical or that's just not like useful, not professional. So, like, for example, that thing I just named of like, I don't know, being late to an appointment, missing an appointment, for people who have been profoundly neglected, which oftentimes sexual trauma includes some type of neglect, especially childhood sexual abuse. There's almost always a in tandem trauma around neglect that allowed the abuse to happen in the first place. Um, uh, Having somebody show up late or miss an appointment or be kind of flaky can actually be pretty activating to someone's nervous system. So, there can be kind of mild stuff like that. Then there can be something like, your practitioner is maybe just like too friendly, or, sees you out in public, or and is like, just not kind of containing the experience enough. So there can be kind of like smaller ethical violations, like a dual relationship is a small ethical not small, it depends on but like, if you're going to see a psychedelic therapist and they also work with your best friend, and you and your best friend have a lot of, beef between each other, like that's not really a good move, right? And then we get all the way into something that I would consider far more abusive, which would be like sexual ethics violations, where guides and therapists, anything from, trying to initiate, trying to groom, making an attempt towards some type of sexual contact that's inappropriate, or actually um, doing some kind of forced sexual contact that's inappropriate. And in some of those cases, with the way that how do I want to describe this? Well, so basically, what I want to say with this is just it really runs the gamut. And in the case of sexual abuse with clients or journeyers, sometimes the person who is the client or the journeyer, I'm going to put it in air quotes, consents to a sexual relationship with their guide or their therapist. And I'm putting it in air quotes because I'm very pro sex work. I'm pro sexological body work. I'm totally pro work that involves sexual contact. If you were going to go see somebody to have work like that, it would be very clearly understood beforehand that that's what you were doing. They would be well trained, again, well trained in doing that work. And you would be negotiating that like so involved. And honestly, probably there wouldn't be any psychedelics involved. Like you would need to convince me that there needed to be a reason to have a psychedelic. I'm not opposed to it, but just basically that would all be like thought about, talked about, very clear and above on the table, in a non-psychedelic, like in a sober state first. So we have practitioners that introduce sexual contact as a sudden, like, hey, you need this for your healing, and they're not trained in it. You didn't discuss it before the journey. That's totally wrong. Like, that's just, I'm just going to go out there and say, like, that is sexual abuse, and people should not be doing that. And part of that is because your ability to consent once you're under the influence of the medicine has been altered. And also just, we never introduce um, a risky intervention without actually having a lot of time to process it and think about it and understand like why it's happening. So all of that I would say is not okay, but sometimes people will consent to something because the guide or the therapist who has a lot of power over them has offered this up and said it's for their healing, and they're sitting there being like, okay, like I guess you can do that to me, okay? But again, that's not actually consent, because consent is so greatly compromised when someone is high, A, and B, when there's such a power difference. Then another thing that can happen is there can be this perception that there's a sexual relationship forming that's consensual because maybe the journeyer or the client has initiated it, or the guide or the practitioner has initiated it. Um, and there's just this idea like, hey, we want to do this, and we're still working together in this clinical way, but we're both consenting to this. And I do not think that's okay. And especially when somebody has sexual trauma, I'll just throw out there that a lot of times, and this is in non-psychedelic spaces, this has been researched. So in with mental health clinicians that engage in sort of like, I'm going to put it again in air quotes, consensual relationships, sexual relationships with their clients, um, most of the time, in retrospect, the experience is reported as traumatic. And a lot of times those people actually have symptoms of the same symptoms as incest survivors. So it can seem like it's consensual because somebody consciously is saying, I'm consenting to this, but it's not consensual when there's this dramatic power imbalance that is just not possible. And, in some circumstances, maybe somebody comes to you for healing work and maybe you feel like, oh my gosh, we should be in a relationship. You would never commence healing work with them and then start initiating that and continue to do this healing work with them, or initiating it around psychedelic work. So, like, for example, for a psychotherapist in California, if I wanted to have a romantic relationship with a client, I would have to terminate with them, wait 2 years, and then I would be allowed to have a romantic relationship. And I'll also throw out there, I would never do that. That is not enough time. That is totally inappropriate. Like, if you work with somebody for like 6 years and then you wait 2 years, it's just not cool. So I could get way, way, way deep into this, but I feel like I'm basically just like saying it's not okay. And it's not
Yes,
consensual,
understood.
even if you think it is. Oh, and I'll also just throw in one more piece. A lot of times, sexual trauma survivors are, and I have a whole episode about this in my podcast. I think the episode's called Dynamics of Sexual Harm and Healing Relationships. I think it's maybe episode 16. But that a lot of times, people who are sexual trauma survivors unconsciously pull for sexual violations. And it's not because they actually want the practitioner to sexually abuse them. It's because what they're doing is communicating something in a very unconscious way about their experience. And that is because when we get back to that piece I talked about earlier, big feelings, when there's really big feelings and we get really dissociated around them, they start to come out in very unconscious ways to get communicated to other people. The technical term for this is projective identification for anybody who's studying or wants to kind of follow up on it. But basically, a client can do something that kind of illustrates, like, oh, maybe we could have a sexual connection, or maybe I'm so whatever, something. And what happens is that the person who's working with them, if they're trauma informed, can note, ah, this is part of the violating cycle for you. You would initiate this with me, and then if I went for it, we would be reconstellating your trauma and actually starting to kind of piece it apart and look at, like, what you're kind of getting, like an unconscious communication about this person's experience. The answer is never to actually sexually abuse your client. Like, that's just never the answer in this kind of situation. And I also think sometimes trauma survivors will unconsciously be looking for the part of you that's not safe. So they may set a, like, very unconsciously, this is not typically a conscious thing. They may set a little trap for you, like, well, would you sexually abuse me if you had the chance? And the most important thing for the practitioner is just to see that and see, oh, you're really scared and you're worried and you don't trust me and you're trying to find out how safe this relationship is. And of course, the answer to this is to not sexually abuse you. That's like the number one intervention in these situations. But a lot of practitioners they're not trauma informed. They don't understand that. And they're busy, like, working out their own shit that they haven't dealt with, and then will abuse the client, which is obviously not healing.
Correct. And thank you. Those are some really powerful points for anybody out there wondering why it's important to not just be quote unquote trauma informed. Like, this is a major set of skills that you need to have to recognize when really subtle things like that pop up, that you continue that you see them and you don't continue the cycle and propagate more harm. And so thank you for that. So say you are somebody who has gone to a practitioner and it appears that they are starting to violate boundaries. And I know there's a lot of different points in the journey. Like, it could happen in preparation, it could happen in this, during the journey. Any advice for what to do at that point, perhaps after? What do you suggest?
Yeah. Now, this part is so complicated. And I say that it's really complicated because there are a lot of, let's see, there are a lot of different pieces to consider, both in terms of how the response that the survivor has, that how much it can actually harm the survivor. So, for example, a lot of people would say, oh, go to the police. That would be like the first thing, like, go to the police. And the police may not actually help you very much, and you may get more trauma from going to the police. So that's not always necessarily the answer. Um, and th- Another sort of, like, really complex component to this is, like, the question of, are you going to confront your guide? And if you confront your guide, how that may impact you. Like, it's possible that person may lash out, they may deny it, they may be more abusive to you. um, they may start, like, kind of mounting a retaliatory campaign, or I mean, there's a lot of stuff people can do that's really scary. um, the Uh, and another piece about doing that is, that you may kind of, I wanna say, like, again, air quotes, "repair" around it, but this person may still not be safe. So, sometimes I think people, it's like, "Oh, I go back and I talk to the person and, we talked it out and they explained and da 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 da," and this person has a lot of power over you. They generally know really a lot about your psychology, and you don't know as much about theirs. And so maybe they repair with you and then you go back in and they actually still have access to you and can keep abusing you. So I think it's really complicated. The big thing I would emphasize for people is to make sure that you get a lot of support outside of that relationship. Um and you can, anytime you want to, you can pause a therapy. You do not have to figure this out by the next session. Let's say you have a session in a week or a session in a few weeks, or you have a medicine session coming up in 3 weeks, but like they said something weird during another session and you're kind of worried. You can always pause a therapy. And there can be such an emphasis on kind of like, no, move forward, or no. You can just say, that was weird for me. I need time. You can go and you can talk to your other people. The other thing about this is, there's a lot of people in the psychedelic field that don't want to acknowledge this is happening. So, like maybe one of the things you think about doing is like reaching out to other practitioners to kind of tell them, hey, your colleague is doing this thing. And I just want to warn people, like, you might not get a very supportive response. And that can be its own kind of wound, that you speak out about something and no one is listening or believing you. So there are people forming up networks, and there are people in the psychedelic field that have kind of named themselves as like, "Hey, you can reach out to me, and I am a person who will believe you, and I'm a person who will support you." Um, if you are concerned about this all at all, I would just get on the internets and start Googling this now and understand, more of what that infrastructure is. It's very small and it's just in the process of forming. But there are certainly people in this field who care very deeply about this and do not want people to be harmed and are believing and collecting stories. Um, but yeah, it's a really tricky situation. And again, I would say, like, slow it down and make sure that you reach out to your community. And it's so complicated, right? Because the person who you would maybe think is the number one person you would go to talk about something like this is your therapist, who is also the person harming you. This is why people end up with the similar symptoms to incest survivors, right? It's like, the person who you think you're going to go to, that's like the person you can trust, is a family member. And then the family member is either doing the abuse, not protecting around the abuse, turning a blind eye to the abuse. So it's really, really tricky. And I would say just like getting support to sort of think through what you want to do around it, and slowing it down.
Yeah, that makes so much sense. And it seems easier if it's like a repetitive kind of, you see your therapist every week kind of thing. I'm trying, as you're talking, I'm trying to like apply this to what would it be like if you'd flown down to Costa
Mhm.
Rica or something, and you're at a 4-day ayahuasca retreat and something happens. This is not a person you're going to see after the 4 days. It's one of the facilitation staff at the retreat center, but you're on day one and you have like 3 more days. I don't even know, like, if this is something that you have off the top of your head, but, like, I don't I mean, I don't even know what I would, because I would want to confront the person, but then you said, like, there's 3 more days where they are technically we're still responsible for your healing, and if they are vindictive, if they, if your response isn't taken well, then that could be just as harmful for those next 3 days. So is this a point where you would recommend somebody kind of just stopping, or any suggestions in that context?
Yeah, so I would say this is where I would get really into the prep work thing. Like, just like, maybe you're going down there with a friend. Maybe you're making sure that whoever the leader of that there's, multiple people who you trust and respect that are leading the retreat. So there might be someone else you could talk to. However, this totally happens where people go, they're isolated, they're alone, nobody on the retreat believes them, and there's some kind of horrible harm happening. What I would say, even if you spent thousands of dollars getting there and paying for it, even if you are struggling so much and you really, really believe that, like, you can handle whatever comes to you and it's okay, if you know there's something wrong, you don't have to you don't have to take the medicine, you do not have to keep doing the journeys, and you can leave. And that's obviously up to anyone's individual kind of decision on that. But, what I think about is just like, we don't incur more trauma to heal. That's not how it works. And uh, just like, I like to think sometimes, it's like, okay, maybe let's say you're going to lose, I don't know, $1,000 on an experience that you are realizing like really wasn't safe. That is awful. Like, and it's totally sucks. And $1,000 means a lot of, a different thing to a lot of different people. But let's say this is like financially really was stressful to get there and you're losing this money. I just am like, think about how much money you're going to spend talking about this in therapy. Like, just as much as you can not incur more trauma in life, which is impossible. Like, we're all incurring more wounding and more, just the nature of being alive. We're always incurring more things to heal. But if you're like, that was really sick, what happened, like something terrible happened in journey 1 and there's 3 more journeys, you don't have to do it. You really don't. I think you could also ask for a refund. Like, I mean, there's certainly things you could try to do to get out, get your money back. But um, yeah, I'm just like, take care of yourself. You actually really matter. And you don't have to do something that's terrifying or that is like, you don't have to live through abuse in order to heal.
Yeah, I think that's a really important point, and I appreciate you bringing that up. That the solution to trauma is not incurring more trauma, and I love the point, which is just essentially get out, stop whatever's going on there. You can figure out the refund later. Save your mental and physical health first, and then what you brought up, and it's part of the safeguards that need to be formed around psychedelic medicine, is that right now, since most of this is non-regulated, the police and the community are seemingly the only two places you can go. But if you look at the medical community, like you said, you're licensed by a psychotherapist board of some sort. And so if your client had an issue, they could report to that board. And that's what's missing right now. And that's what's being, one of the things that's being formed is a psychedelic practitioners association with guidelines and a certification and a place to report when these adverse events happen. And so that's a big part of what I think will help this, because right now it's, like you said, there isn't anybody few people that are receptive and know what to do with the information if you bring it to them. So hopefully that does progress.
I do think, yeah, and I'm totally for that. I also want to point out that, so, in my Horizons talk, I mentioned that in the field of non psychedelic mental health work, um, people self-report sexually harming their clients at rates of 7 to 12%. So what I mean by that is 7 to 12% of mental health clinicians in the US self-report that they have sexually violated one or more of their clients during their careers. And that is a really big number. And those are people who are above ground. Those are social workers, psychotherapists, counselors, all different kinds of people where they have a licensing board that they can, and that can be reported to, that can reprimand them. I don't want to get super into specific cases, but there have been a number of high profile cases in the US with psychedelic medicine, where the person who is the abusing therapist is licensed and still practicing and not actually being having their license taken away. So I do want to say the licensing stuff, it doesn't necessarily prevent it, but I think that it is an important protocol. I also think that one of the a very, very important thing is to be thinking about consumer education. And I mean, that's where a lot of what we're talking about in this podcast, like, for example, with the psilocybin bill in Oregon that has passed, where, in 2023, you're going to be able to access psilocybin. I don't know, not necessarily psilocybin therapy, but psilocybin healing. And I think at this point that the protocol for how someone can become certified to do that is pretty small, like what someone has to go through in order to become a guide. Um, and so when we look at that, like, my hope is that when it's above ground and you can look at someone's website, and what's normal on a lot of people's websites is that they say, here's all my trainings, here's how long I've been in practice, here's what I'm doing, that for consumers, they can go and they can see, okay, this person started practicing this however many years ago. This is what their training is. You can look at their Yelp reviews. Like, I know I'm not like a huge fan of all this stuff like Yelp reviews, but But I do actually think like there's a way that when it's above ground, there might be a little bit more room to talk about it. And it's still happening in the above ground. So
Yeah, absolutely. Thank you for bringing attention to that. It's very true. And that is a shocking number. And that is self-reported. So that means that there are still some that are not reporting. So that number is actually higher. So yes, pay attention to those online resources when available. This leads to the last thing I'd like to cover, and it was a really powerful part of what you talked about in Horizons, is the healing that needs to be done to that our healers need to do to stop propagating this abuse. Can you talk a little bit about that?
yeah. So when I was asked to come and speak at Horizons, I mean, it's scary. It's scary to talk about this. It's scary to basically stand on a stage as as a trauma survivor myself and to say about my colleagues, like what you're doing isn't okay. It's I just have to emphasize like I was very stressed out leading up to this. And I only gave a 10-minute talk, so it was like you have I know. A lot of people like really were like, "What? I thought that was so much longer." But, it's so I was like I could talk for an entire day on this. Like, what am I gonna say? And, I did a lot of soul searching. I did some medicine work. And what I came to, is that there's, I mean, when we talk about sexual violence, we get so kind of disorganized internally. It is so painful to think about what's really happening, to actually, in an embodied way, be like, this is what's going on, man. Like, people are taking psychedelics with people they trust and they're being abused. It's horrible. And it's easy to want to get into a place where you push it away, and you push it away by being self-righteous. You push it away by, getting up there and just like going hard on the one person that is publicly being called out at the moment or whatever. And that would have been very compelling, it would have been very compelling. But ultimately, I've spent a lot of years engaged in community responses to sexual violence as well. So, like, I know that just kind of being like that one bad apple, it's not useful. Being really self righteous and, getting up there and being like, this is wrong. Like, these people got to get taken down. Like, might feel good. It's not going to end abuse. And that's why, my big message was just like to everybody in the room, like, we need to show up to our own healing because that's why we abuse people. That is why we harm people, is because we are not doing our own healing work. And so, yes, like for any practitioner that's listening, that's like, I would never do something like that. I'm like, first of all, don't say never. Maybe you know that you would never, sexually abuse somebody, but you can't say that you would never do any kind of harm. And part of why you can't say that is because we oftentimes cause harm unconsciously. And the biggest safeguard that we can have against causing harm is to just show up and do our own personal work. Even when you think you've healed all the way through something or whatever, like you got to go in and you've got to just like keep working it throughout your lifetime. And if you're a healing practitioner of this type, your instrument is your own being. Like you don't just heal it all by the time you're, I don't know, 30 and then never do any more healing work. Like you lose things, you accrue other traumas, you when I say lose things, I mean like, deaths happen, all kinds of things happen in our lives that we have to keep doing our healing work. And especially if you're a healing practitioner, that's not really a choice anymore. Like that's part of committing to the path. So for psychedelic guides that are not doing their own healing work, like I'm just like, we gotta show up. We gotta do it. We gotta do it
Yeah.
for ourselves and for our clients.
Yeah, absolutely. And I appreciate you bringing up that point because you're right. That's the compassionate way to think about this because shaming people is not going to work, but acknowledging that this may even seem sickening to you as a therapist when you hear these stories, but again, that kind of gets back to if you're not properly trained as to what proper touch is or isn't, then how do you know that you're not already crossing some sort of boundary? Like I did a group ceremony for women. I was one of the participants, and the facilitator said, "I am a man. You all are women. Like elephant in the room." He said, "I will not touch you unless you specifically request. Like, can you put your hand on my hand right there?" And it was so clear. And I thought back to other types of touch and other ceremonies, and I was like, "Whoa!" So many people violated so many boundaries. It wasn't until I saw a clear set boundary that I realized how wrong some other situations had been. So I think, there's so much short of having, actual sexual intercourse with your client. There are a lot of other boundaries that can be violated. And I think that's what a proper training program is important. And that self-evaluation, if you're never looking at your own issues. And one thing that you and I hadn't yet brought up, but we talked about who else can you report to, but if you're searching for a practitioner and they don't even I advise anonymous feedback forms, because you shouldn't have to confront the person. But if they get an anonymous feedback that says, I didn't really appreciate kind of the way you were rubbing my shoulder, maybe they'll think twice. Oh, maybe that was, they need some feedback as well, because they may not recognize that they were just being compassionate, but no, they've crossed a boundary in your world. So maybe that will think, I will ask next time before I do a shoulder rub kind of thing. So I think that's another thing to look for, do they take feedback? But I appreciate you putting that back on the therapist in a way that we need to keep doing the work. Not we personally, I'm not a therapist, but the therapist community needs to continue to do the work. And that's how we're going to up level kind of as a field. And so thank you for that emphasis. This has been fascinating, and I think we could talk forever, on basically any of the topics that we've covered. And I'm just so honored and grateful that you've discussed this many things with us. And I suggest everybody who is interested take a listen to your podcast. So if you could tell us about, I know you've got a new book coming out and a podcast, tell us all the places that we can learn more from you.
Yeah, so my podcast, for people who are interested, it's called Inside Eyes. It's really more of an audio series, but it came out as a podcast. So you can go all the way back to episode 1 and listen to it, and it kind of sets up the whole series for you in terms of thinking about this stuff and going into kind of what it is. So Inside Eyes, you can listen to it anywhere on any podcasting, wherever you listen to your podcasts. And then I also have a book coming out. It's called Radical Healership: How to Build a Values-Driven Healing Practice in a Profit-Driven World. So for people who are listening who are maybe psychedelic therapists or guides, and they're thinking, or people who are thinking about doing that, it's a book that's it's like an anti-capitalist self-help book for healers. It's just all about how do you walk this path, both professionally, personally, and it's not specific to psychedelic work. However, I will add, I took a lot of psychedelics to write the book. So it's definitely imbued with a psychedelic vibe. And actually, for people who are interested, there is I can offer a discount code for the book. The publisher is North Atlantic Books. And if you go to their website and you find the book on their website and put in the code RADICAL35, it's not case sensitive, you can get 35% off and free shipping. And that is going for a bit, but hop on it soon, because the discount code doesn't last forever. And the final thing I'll say is that, if you're interested in hearing more about my work, I'm most active on social media on Instagram. And my Instagram handle is at Laura May with an E Northrup. And if you just want to hear from me once a year and you don't use social media, I have a newsletter. So you can find that on my website at lauramaynorthrup.com. And I really only send a newsletter once a year.
Once a year. That's amazing. That's amazing. And anything off the top of your head, because we'll throw it in the show notes, where anybody who has, like you said, that they can Google and find, but anything off the top of your head where people who have perhaps had a sexual violation of some sort in psychedelic healing, anywhere that they could go?
Yes. And I have to it's so new that I have to remember and look up the name, but I will email it to you right after this so you can throw in the show notes. Yes.
Okay. So we will, sorry, everybody listening in your car. This is where you go to the show. But at this point, it's still plantmedicine.org/podcast. We may get a new website, but we'll make sure you find it there. And then we will link to it from Instagram and all the things. So Laura, thank you so much for the work that you do and for just sharing so much of your wisdom with us.
Yeah, thank you for having me, and thank you for, just being brave enough to have this kind of stuff on your show. I know this is it's heavy topics, it's hard topics, and it's so essential that we're talking about it. So I appreciate that.
Well, thank you. I'm a little self-ashamed that it took 102 episodes to get us here, but I think I was just waiting to meet you because I had not heard you speak before Horizons, and I don't think that there would have been a better resource. So I'm glad that in my tardiness, we have gotten the gift that was this conversation with you. So thank you, Laura. And for everybody else out there, until next time. Thanks so much for listening to the Psychedelic Medicine Podcast. If you enjoyed what you heard, please leave a rating or review, as it helps others find the show. And if you'd like to learn more, you can find the show notes at plantmedicine.org/podcast, and there's information for clinicians at psychedelicmedicineassociation.org. Our incredible music was by the one and only Porangi. We'll see you next time.